One of the questions that I'm asked is, gee, Dr. Harness, after a mastectomy, do I still need to be screening or looking for potentially the cancer coming back? The answer is yes, and let me explain. So even with a mastectomy, can a cancer come back, either the original cancer because of the biology of it, or because microscopic normal breast tissue is left behind? Could you 10, 15, 20 years down the road develop a breast cancer at the mastectomy site? And the answer is yes. And depending on the biology of the cancer, typically we quote 2 to 4% chance of a cancer coming back at the mastectomy site. With certain types of in situ breast cancer that involve large areas of the breast, we really worry that at the microscopic level there can be some cancer cells even left behind even with a mastectomy. And so the most important part of looking for a recurrence of the cancer is self-examination. A second component of that is seeing your surgeon and medical oncologist on a regular basis, who he or she should be doing a physical examination looking for a possible recurrence even at the mastectomy site. I would say most of the time if there's going to be a recurrence, it's usually the patient who finds it. Therefore, not ignoring that site is really important. And of course, we're always going to be diligent when it comes to the other breast, if the other breast is still there, or even if there's a mastectomy on the other side. Now, in certain circumstances, we will use mammograms and MRI as a way of detecting a potential recurrence. You can do mammograms with reconstruction. Even though there's an implant there, you can still see enough to know if there's something going on, particularly with in situ breast cancer that may make little microcalcifications. And then in the more advanced breast cancers called stage 3, where lymph nodes are involved and others, most of us use breast MRI trying to look and also see if we can find what's called a local regional reoccurrence. So it's really important, even after a mastectomy, to be diligent, to be doing breast self-examination, to be seeing your providers on a regular basis, and then ask your providers, are mammograms indicated in my case, or would a breast MRI even be indicated because of the extent of my original cancer?
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.